The highly contagious Delta variant is leading to a surge in COVID cases and hospitalizations all across the country. Cases are up 9% and much higher than that in several states with low vaccination rates.
Many of you have asked us about how prevalent the more contagious strain of the virus is in Oregon. So we sent Elise Haas to talk with the Oregon Health Authority to get answers. And Elise, what did they tell you?
Ken, the Delta variant really started showing up in May, but Oregon was well through the vaccination rollout at that point. But the Delta variant is thought to be 50% or the most transmissible variant so far at this point. And even though we know that COVID data lags just because of the time frame and when it becomes present with symptoms, the Delta variant doesn't seem to be very prevalent in Oregon yet like it is in other states. At this point, the evidence shows that there are 13 cases of the Delta variant in Oregon, and it's generally been recorded within the highly populated northwestern part of the state and then also the less vaccinated far eastern part of the state. So this all includes Clackamas, Clatsop, Columbia, Multnomah, Tillamook, Washington, Baker, Malheur, Murrow, Umatilla, Union, and Wallowa counties. But do compare those 13 Delta cases to then the 1,700 recorded cases of the Alpha variant of concern, which has been more prevalent here for quite some time now. But scientists believe that the Delta variant is 50% more contagious than the Alpha variant. So it may just be a matter of time before the Delta overtakes it. So what does all of this mean? Well, when I was talking to the Oregon Health Authority, they said that yes, all the FDA COVID-19 vaccines work well to prevent infection from all variants of COVID-19, including the Delta variant. Even if it is lessened, it's still better. But OHA says that community spread remains elevated in areas with lower rates of vaccination, meaning Delta could become a pandemic really among the unvaccinated. So who should be concerned? Really, we all should be concerned because this affects everyone. But most importantly, it's the folks who are unvaccinated and the folks who only got one dose and never went back to get their second dose. So as we have now moved into a time where all of the restrictions are lifted, OHA just wants to remind everyone that the vaccine still remains the most effective tool in reducing the spread of disease within our communities and within our families. Emily and Ken.
All right, thanks, Elise. Well, we're asking tough questions this morning as Oregon's death toll from the